Hello, my name is Kyle Advadi, nurse practitioner here at Echo Medical. Today we're going to talk about chronic venous insufficiency and the outpatient treatment options we provide here at Echo. Before we get into venous insufficiency, you first have to understand what veins are and how they function properly. Veins bring blood from the feet back up to the heart for recirculation, working against gravity. They rely on having valves that prevent the backflow of the venous blood to efficiently return the blood to the heart. For a variety of reasons, the valves can wear out and lose their function. This increases the pressure in the veins, causing them to become dilated or too large. This results in backwards flow or reflux of the blood through the valves, which results in symptom development. Symptoms typically reported are lower extremity swelling or edema, worse at the end of the day, spider veins, cramping in the legs, burning, restless legs at night, itching, discoloration, heaviness, painful varicose veins, and possibly venous leg ulcerations. Also, it's possible there's no symptoms with mild venous insufficiency. At Echo Medical, we perform comprehensive circulatory evaluation. For our purposes right now, we perform an in-depth venous ultrasound to get a diagnosis and to formulate a treatment plan. We have two venous systems, a superficial and a deep venous system. During your ultrasound, we evaluate both systems to rule out blood clots, evaluate the size of your superficial veins, and to check for venous insufficiency in the superficial system. So who gets CVI? It's very common. The likelihood of having venous reflux increases with age. Symptoms affect approximately 50% of men and 60% of women over the age of 50. Pregnancy and hormone changes increase likelihood of venous reflux. 13% increased risk with your first birth, 30% with the second birth, and 57% with more than 2 births. Environmental factors include prolonged sitting and standing, low activity levels, and obesity. Other risk factors are smoking, high blood pressure, previous leg injury or surgery, and a history of DVT. Family history plays a significant part in varicose veins. If neither parent has varicose veins, you still have a 20% likelihood of developing varicose veins. If one parent has varicose veins, there's a 25% likelihood in males and a 62% likelihood in females. If both parents have varicose veins, there's a 90% likelihood you will develop varicose veins. During your consultation, a provider will discuss your ultrasound results where you can develop an individualized and collaborative treatment plan. Your provider will explain the findings of the ultrasound and which veins are affected so that you can discuss your symptoms and correlate them to the ultrasound findings. Conservative therapy is required by most insurance companies, which entails supporting your venous health by minimizing risk factors previously discussed, increasing activity and mobility, attempting weight loss, and wearing appropriate graduated thigh-high compression stockings. Conservative therapy is typically required for a period of about 1 to 3 months, depending on your insurance company. At Echo Medical, we provide advanced, minimally invasive treatment options, including VenaCure laser ablation, VenaSeal glue venous ablation, and foam sclerotherapy. Your insurance and personal ultrasound results will determine which treatment option is best for you and will be reviewed with you during your consultation. Surgical options of phlebectomy and vein stripping are performed at Echo Medical only in very specific scenarios and can be discussed further if indicated. The procedures we offer at Echo Medical are completely outpatient, use local anesthetic, and allow you to walk out the same day of your procedure. Let's discuss the 3 options we offer here at Echo Medical. First, the VenaCure endovenous laser therapy, the VenaSeal glue venous ablation, and the foam sclerotherapy. Both the laser therapy and the glue procedures use the same fundamental steps of accessing the vein and sterile preparation. During the procedure, you are prepped and draped using sterile technique to be able to minimize risk for infection. Ultrasound is then used to assess the vein and determine where to access the vein. The VenaCure laser therapy utilizes a laser that heats up and causes inflammation around the vein being treated. During the laser procedure, the access site, when treating the greater saphenous vein, will be at or above the knee on the inner aspect of the leg to avoid damage of the saphenous nerve, which runs close to the greater saphenous vein below the knee. The access site will be above the mid-calf when treating the small saphenous vein to avoid damage to the sural nerve, which runs next to the small saphenous vein. Once the access site is determined, I use local anesthetic such as lidocaine to numb up the area of the skin, where I will then use a needle to access the vein under ultrasound. Once I've established access, I will make a small nick in the skin approximately 2 to 3 millimeters, just big enough for me to be able to guide treatment wires and catheters through the vein to the area of treatment. Once I've guided the wire and catheter to the area of treatment, I numb the entire length of the vein using multiple needle sticks so that you don't feel the actual laser part. This also protects the tissue surrounding the vein. Because this requires more than one puncture, we do offer the option of taking a Valium to help relax prior to the procedure. This would require you to have a driver the day of your procedure. Once you've adequately been numbed, the laser is turned on and pulled back, shutting down the vein until the access point is reached. Venous insufficiency of the saphenous veins below the level of laser therapy is treated with foam sclerotherapy if needed. To access the vein, a small butterfly needle is inserted into the vein using ultrasound, and a foam sclerotherapy agent is injected using real-time ultrasound guidance. Appropriate compression stockings are required the day of your procedure for all laser and foam sclerotherapy treatments. Our staff will assist you in putting these on before leaving the clinic. You will also have an ACE bandage applied with foam padding along the region of lasering, which can be taken off after 24 hours. Compression stockings will need to be worn 6 additional days to ensure proper closure of the veins and to prevent them from opening back up. The VenaSeal procedure does not require all-day needle sticks since your leg doesn't need to be numbed for the procedure. The same technique as previously discussed is used to access the vein. The VenaSeal catheter is then positioned appropriately under ultrasound, and then the vein is glued shut. No compression stockings are required after this treatment, but can be worn if you prefer. Results vary by each individual, but can take up to 90 days to achieve maximum effect. The remaining veins not shut down by your procedure will take over, and your body will adjust over the course of that time, and you should see improvement if symptoms are correlated to your venous insufficiency. No procedure is without risk. We treat the VenaCure and VenaSeal procedures as sterile vascular procedures and prep your leg with a cleaning solution identical to ones used during surgeries. The provider and their assistant will be gowned, gloved, and masked using sterile technique and sterile equipment to prevent risk for infection. Anytime you puncture the skin of the body, there is risk for bleeding or bruising. There will be some bruising and tenderness after the VenaCure system at the areas punctured for tumescent, but typically resolve within 2 weeks, longer if you're on blood thinners. Overall blood loss is minimal and is achieved by using the smallest wires, needles, and catheters necessary to treat your veins. Pressure will be held at the end of all procedures to ensure bleeding is stopped. Risk for blood clots in the deep venous system is increased when treating your superficial system, but the use of ultrasound minimizes the risk as much as possible. The typical follow-up when treated with VenaCure laser therapy is to return to the clinic in 2 weeks. Our nursing staff will assess the areas treated and answer any follow-up questions you may have. This will be a very quick visit. Your next follow-up and ultrasound with all treatments will be 1 month after completion of your venous treatment plan. You'll complete a venous ultrasound and discuss the results with the provider to determine if any further treatment is needed. If no treatment is indicated, your 3-month ultrasound can be scheduled. At your 3-month ultrasound, if no treatment is indicated, patients can follow up on an as-needed basis. We look forward to sitting down with you in consultation and discussing your symptoms and personalizing a treatment plan that helps improve your quality of life. Thank you for your attention, and a provider will be with you shortly.